because I'm lazy, but because the white coat to me means something that doesn't actually change. The way, it's not subject to current events or the state of healthcare or growth of naturopathic medicine. The white coat is an opportunity to put something on that designates a special experience, what I would refer to as a sacred experience. And if you look at the literature in religion and in anthropology, there is a lot written about the difference between the sacred and the profane. Profane meaning ordinary, not profanity. And whether it's religions or cultures, we have different ways that we designate a time that's sacred. And to use a well-worn phrase that's attributed, I'm not sure if it's actually accurate, to Winston Churchill, who said that we make a living by what we get, we make a life by what we give. And in naturopathic medicine, we have an opportunity to give something really extraordinary and special to our patients, and we make a nice living at the same time. So how cool is that? The moment that you guys put on your white coats today, and certainly in the coming weeks when you are beginning your clinic rotations, you enter this new phase in your clinical training, which is what you really came here for. I'm sure that you would all tell me that. Why did it take so long? To be seeing patients. And that experience, you'll see, I'm looking at some of our clinicians here, how many times has a patient said to you, "Doctor, I've never said this to anybody before." It's an extraordinary relationship that's not just confidential, because you will have the opportunity in the course of years and decades of your careers to make the kinds of changes in people's lives and to help people literally transform themselves from illness to health. And you'll have extraordinary experiences where children are born, and you'll also have patients who pass away and die. And to me, there are very few professions in the world that have the opportunity to do something that is so closely connected to another human being in a way that brings out the goodness in you and the goodness in your patients. So what does this have to do with the white coat? When I was in practice, putting on the white coat, to me, meant that the traffic and whatever it was that I had to put up with to get to work was in the past. Whatever I had going on the rest of the day or the rest of the week or that weekend or that night was in the future. The white coat is the present. So when you put on your white coat and you wash your hands, some of it is hygienic, but some of it is also a sacred ritual where you are cloaking yourself in a garment that designates that this is a safe place for your patients, that you have a blank canvas, that you're going to listen without judgment, and that you are going to give from the purest part of your being everything that you can to help your patients. And so when you start your clinic rotations in the coming weeks, take a moment when you put your coat on, if you're running out of either a classroom or from one exam room to the next and you're putting it on, take a moment to take a deep breath and experience the significance of what you're about to do. Do it for your patients, and I would say do it for yourselves as well. Congratulations to all of you. You guys are extraordinary. Thank you. So I'd like to introduce the sponsor of the White Coat Ceremony, which is Patrick Sullivan, who is the CEO of Jigsaw Health. Unfortunately, Patrick is not here. Patrick, his wife Ashley, and their kids are on vacation. And I don't know how many of our students here have been to a lunch and learn from Jigsaw Video, but Patrick is very bright, engaging, very generous, and very genuine person. And so since he couldn't be here, he made a video.
Students, congratulations on taking this big step. I apologize that I'm not able to be there with you today. As CEO of Jigsaw Health, I'm extremely honored to have our logo on your white coats for the next 2 years. When you see that patch, please remember that Team Jigsaw is here to support you in any way that we can. Dr. Mittman, thank you again for giving us this opportunity. Jigsaw Health is often referred to as the magnesium people. We published a clinical trial called the Scottsdale Magnesium Study in the peer-reviewed Journal of the American College of Nutrition. The principal investigator was Dr. Decker Weiss, himself a graduate of SCNM, although I think that was a few years ago. Now, I'm no professor, and students, I'm sure you're tired of classes, but if you'll indulge me, I'd like to take this opportunity to teach everyone a little something. For those of you that don't know, magnesium is an essential mineral, an electrolyte actually, except for some reason, magnesium is never included in electrolyte drinks like Gatorade or Powerade. Magnesium seems to be the Rodney Dangerfield of minerals.
Boy, that's the story of my life. No respect. How to get no respect?
Magnesium just can't get no respect. I think it's because most people don't even know what it does for them. So here at Jigsaw, we thought, if we wrote a song about magnesium, maybe people would understand it better. I mean, things are working out pretty good for the alphabet. I've asked my lovely wife, Ashley, to help me out. Oh, there she is. Hey, Ash.
Hi.
Hey, do you want to sing a song about magnesium for these fine people?
You know I do. I needed too much coffee. I drank too much wine. On the verge of hangry. Could never sleep enough time. But then I discovered in a natural way the mineral I was missing. And it's a brand new day. Now I feel calm, so energetic. I feel rested, yeah, 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 and downright regular. Oh, sweet magnesium, calm and rested, yeah. Oh, sweet magnesium,
Downright regular.
Are they laughing?
I don't know. I can't really tell. Dr. Mittman, are they laughing? Oh, good. They're laughing a little bit.
Good, because as we always say, laughter is the best medicine. Magnesium is a close second.
Thanks, Ash. Maya Angelou said, do the best you can until you know better. Then when you know better, do better. Parents, family members, friends, take extra pride in the step that these students are taking today. They've discovered that naturopathic medicine is a better way. Students, it's time to put on those white coats and get ready for the good stuff. The stuff I'm sure you've been waiting to get to. The poking, the prodding, the stitching, the sewing. You can now begin the fourth principle of naturopathic medicine, tolle totem, or in English, treating the whole person. Ladies and gentlemen, look, if you remember nothing else of what we've said or sung here today, please remember this. Laughter is the best medicine. Magnesium is a close second. Congratulations, students.
Thank you, Dr. Mittman, and thank you to Mr. Sullivan and Jigsaw for their continued support of our school. I assure you, he didn't just do that for the video, he would have done it in person if he was here. So that is Mr. Sullivan. So before we continue with the ceremony, I'd like to take a moment to recognize the student leaders who have helped steer their class to this point in their journey and who have made this celebration possible today. Their hard work and altruistic drive provide a source of cohesion and camaraderie for their class. Please stand to be recognized as I call your name. Class President Lauren Latanza. Class Vice President Ryan Abdelnour. Class Treasurer Nicole Lauren. And Student Advocate David Saba. The class would also like to recognize all the attention and efforts of Student Advisor and Engagement Coordinator Raquel Walsh-Perez in organizing today's events. She's hiding in the back, waiting for them to come back there. So thank you for all your hard work. The journey that this class has been on has not been an easy one. The path to becoming a doctor is vigorous, taxing, and arduous. With them on this journey have been their faculty. These dedicated teachers have shaped, motivated, cajoled, driven, challenged, urged, and sometimes dragged these students through copious volumes of medical knowledge and practices. However, without these committed educators, this class would not be here today. We ask the faculty members in attendance to rise once again so that we can recognize your contributions towards this milestone event. Faculty, if you could please rise. Even though the students would like to give an award to every faculty member, they would like to recognize one teacher who they felt summed up their basic medical sciences experience to date and represents an outstanding commitment to the student. To present this award, please welcome to the podium the class of 2020's president, Lauren Latanza.
Thank you so much. When I was told that we would be holding an Outstanding Faculty Award, I obviously put it into the hands of our class. And I'm happy to present to Dr. Laskew. Surprise! Dr. Laskew put in years so that we can have time off before boards to prep for boards. And if you've seen any of us walking into boards, you know that we needed that time to prepare. And so thank you so much for your grace and patience with us. We are so thankful for you.
Congratulations, Dr. Laskew. It is a tradition of the White Coat ceremony to gain insight into the experiences that have brought the class of 2020 to where they are today. As such, we have two speakers to help provide us with this understanding, one from the perspective of the students and the other from faculty. Our first speaker today is Lauren Latanza. Lauren came to SCNM from Arizona State with a degree in psychology and Spanish. Since starting at school, Lauren has been actively involved in the SCNM community. She is class president for the class of 2020, a student spotlight contributor during new student orientation, and president of the Natural Speakers Club. She is guide and colleague to her classmates and steadfast support in the tempest that is medical school. Here to share a glimpse into the adventures of her class thus far, Lauren Latanza.
Thank you again. I'm gonna be typical and can't go anywhere without your Hydro Flask. I want to start by saying how honored I am to be representing these 47 brilliant students I stand before. I'm continually grateful that you have placed your faith in my hands, and I can only hope that I make you all proud here today in front of your loved ones. A big thank you to Jigsaw for sponsoring this wonderful class. Our musical talent, Erica and Ralph Sanosuaso, thank you for letting us hijack your vacation and put you to work. We really appreciate you. And to everybody at SCNM for putting on this event, especially Dean Donnelly, Raquel, and the members of our White Coat Committee, and Rachel and Ashley for this beautiful floral arrangement. Thank you so much. There is a lot that goes on behind the scenes for something like this, and we are all very lucky to have you. With that said, I now thank you all so much to everybody for being here. I know that you have come from near and far, and I think I can speak for all of us when I say that your support means more to us than you can really understand. You have been there for us through the highs and the lows. You've been present for the celebrations of us somehow passing all 10 finals in 1 week. And you've been there for the full-blown meltdowns when we wondered why in the heck we signed up for this to begin with. You have served as a constant reminder that we can, in fact, do this. Your steadfast belief in our knowledge and our character in times of doubt has pulled us up from the depths of despair. When you provide an occasional meal, a much-needed happy hour, or simply reminding us, you're in med school, what did you expect? I can tell you that we are eternally grateful, and we will eventually get you back one day. At the start of our program, I believe it was Dr. Schmidt that told us that the following 4 years would be like trying to take a drink from a fire hydrant. Dr. Schmidt, you weren't wrong. Not by any means. While I believe that most doctoral programs might mirror this level of intensity, I feel that the very essence of naturopathic medicine is what leaves us feeling like the amount of knowledge coming at us is truly immeasurable. Trying to comprehend the millions of functions the human body is capable of is a task in and of its own. Then add to that not only 150, 200 years of medicinal research and allopathic treatment, but also thousands of years of healing traditions handed down from generation to generation. For this reason, I always say that we are not practicing alternative medicine. This is as traditional as it gets. Now, with extensive scientific research, like that conducted by our own Dr. Langland and many of the students in here today, I am happy to say that the world, and our nation especially, is finally getting on board. Since we have started here at SCNM in 2016, 3 states have gone through full legislation, making naturopathic physicians a recognized and regulated profession. 7 more states have bills pending, and 6 more with similar plans for 2019. We truly are the future of medicine, and our future begins with this white coat that we've been dreaming of tirelessly for the last 2 years. The tradition of the white coat ceremony began at Columbia University in 1993 by Dr. Arnold P. Gold as a ritual and rite of passage of new students entering medical school. This ceremony was used as a time for students to pledge themselves to the guidelines and expectations of practice. Dr. Gold believed that this should be done before entering school and not upon exiting, so this is how it is done in hundreds of schools across the country. Contrarily, naturopathic medical schools hold white coat after the 2 years spent studying biological sciences before entering patient care. I believe that having white coat at this point in our education has given us a greater appreciation for taking this oath of dedication and professionalism. Our professors have held us to great standards and administered to us great responsibility. We have, in every sense of the words, put in our blood, sweat, and tears to get here today. For example, early on in the program, we had our aptly titled Stab Lab, where we put our faith into each other's hands to perform multiple blood draws. However, last quarter's IV lab might have gotten a little bit more messy. Note that the catheters do not self-occlude. Our sweat is from the many laps around the parking lot on 100+ degree days just to get out of CC 150 for a few minutes. And our tears, do I even need to explain those? I didn't think so. If you know any of our history, you'll know it seems like we've been in school for what feels like forever already. And that's because we have. But this extensive education has served us well to this point. Like going back to first grade reading skills to sound out drug names while studying for pharmacology, or high school chemistry teaching us the difference between high and low pH to now interpret patients' arterial blood gas. We work hard, and I'm so proud of us all today. I'm proud of our cohesiveness. There is rarely a deadline, discussion post, or exam that goes by without a Facebook reminder. We've had Dusty guides, Alex's guides, and Annie's guides. We've been spoiled by Amanda's incredible pre-tests, and lucky enough to use Ryan or Kaylin's quarterly assignment calendars to guide us through the 11 weeks of madness. Having my computer crash 3 days before finals this past week really showed me how much support there is among us. Julia, Ashley, and of course Shay, I cannot thank you enough. This is such an open-hearted community and one which truly embodies the spirit of healing. While we may have started this journey with the heart of a healer, We absolutely could not have gotten to this point without the wisdom of our professors. We have spent many hours in the class and lab with your patience and guidance to get us past the hurdle, which is NPLEX 1. Your stories, drawings, and demonstrations with stuffed animals in the shape of bacteria have gotten us here. That's actually a thing. With admittedly a few stints of what Dr. Messer so appropriately calls educational bulimia to get us by, we have made it through 195 credit hours to date. To give you an idea of the magnitude of this statistic, most bachelor's degrees are complete after 180 credits. We have spent 33 of these hours in Gen Med alone. Our beloved Dr. Howell has painted pictures of her days as a resident and pediatrician in West Texas that will serve us all and pay it forward so that none of us would miss that elusive case of Hennek-Schonlein purpura. And Dr. Laskew, with his beautiful Albanian accent, has written, repeated, and asked us the answer again and again because it is on the blueprints, okay? You two make a great team and really write some exams worth losing sleep over. Neither success nor failure lasts forever. We will use this knowledge and continue to evolve. Up to now, we've been mostly taught to know the facts, the science of medicine. Now we dive into our practice of the art of medicine. We will practice the art of understanding how to apply these facts and help someone. The next 2 years, we will learn to be present and understand that each patient we see is a potential to positively impact somebody's life, and not just one. If my late grandmother had a day without pain from her severe rheumatoid arthritis, my whole family rejoiced in that. Because this group of us here today is learning the hands-on of compassionate patient care, we will enable thousands of patients in our careers to lead a life feeling better. What we pledge today is an oath not only applying to our profession, but to our entire life. It is the beginning of a process of professional development that will never stop as long as we are in practice. Now, with these beautiful white coats that we've worked so hard for, we begin our true journey as healers. Thank you.
Thank you, Lauren. Now for the faculty's perspective. Dr. Diane Grice is a clinical faculty member and primary care physician at SCNM. After earning her bachelor's in human biology at Indiana University, Dr. Grice graduated from SCNM in 2013. She completed 2 back-to-back residencies in our clinic, one in general medicine and her next in homeopathic medicine. She is a member of numerous naturopathic associations and founding member of the Psychiatric Association of Naturopathic Physicians. The class asked Dr. Grice to speak to them today because they feel she embodies the very concepts of naturopathic doctor. She believes in the healing power within each person to maintain health and the potential within each student to become future healers. Additionally, she also stands as an example of what they wish to become: respected, trusted, and caring. Ladies and gentlemen, Dr. Diane Grice.
I'll take some water too. All right. Welcome to the class of 2020. I would like to start by saying thank you to the family and friends who have come to join in support today. I know it means the world to our students. You certainly have a lot to be proud of. I have watched this class grow over the last 2 years, and I have to say, they are one of my favorite classes. And no, I don't say that at all of my white coat ceremony speeches, but yes, this is my first white coat ceremony speech. But it is truly an honor to be called to stand here before you today to celebrate this rite of passage. The SCNM White Coat Ceremony marks your transition from classroom to clinic. From case vignettes and multiple choice questions to real patients with real medical histories and personal histories. It's quite a big step. I remember sitting where you are 7 years ago, and I had a lot of excitement and some fears, which some of you may be experiencing. I can't wait to see this medicine work. Am I up for this? is Dr. Messer gonna expect me to know the right remedy? When I first entered clinic, I was focused mostly on differential diagnosis, performing physical exams perfectly, and treatment plans, which are important, don't get me wrong. But what I've come to realize is how important it is to relate to people on a human level. Remember, your patient is a human first. Yes, they are coming to discuss their medical symptoms, but don't forget to consider their culture, their home life, and what motivates them to heal. This career is an honor and a privilege, and it needs to be given the utmost respect. Your patients will be trusting you with information they have likely not divulged to anyone else. Be present with what you are doing. Make sure you are calm, collected, and grounded. Leave your worries at the door and try to hold compassion for each patient who you share space with. Remember that your attendings are human first. One of the more unexpected aspects of clinic is working to strive to communicate with people with different personalities, different backgrounds, different expectations. So flexibility will be needed. For some of you, this may be an even greater asset than the medical side of clinic. You may find that this side of it, learning to communicate, learning to discuss difficult subjects, learning to hold space for your patients during a difficult time, is more impactful, more meaningful, and is more useful in your working with your patients. When you're being pushed, know that your attending believes that there's more that you can offer, a deeper understanding. Don't be afraid to ask questions, clarify treatment approaches, or even discuss an emotional case that you're having a difficult time processing. You will learn the practice of medicine from these attendings, but more importantly, you will learn the art of the medicine. When I was a quarter 10 student, I was taking one of my first primary acute cases. I took the next 20 minutes or so to ask this woman about her painful urination and urgency and frequency, and I went back to the classroom to report I was so excited. I'm certain she's likely got a urinary tract infection. The attending stopped me before I could say another word and said, "Why didn't you stop the intake and get a urine sample? We would have already had the results by now." I was crushed. How did I mess this up, I thought. And after returning home that evening, I continued to feel defeated. I had taken her feedback personally. I thought I would never be a good physician because I missed something so simple. The important thing was to make sure that the next case of painful urination, I learned from that previous experience. I would stop, leave the room, and get the sample. And once I did that, I realized that that's how everything is in clinic. I would hear myself saying something on one shift that I had learned in a previous shift, just the day before. Week by week, my knowledge got deeper and more diverse as I heard more cases from these various different shifts. That brings me to my final point. Remember that you are human first. Be gentle with yourselves. Your first 2 years went fast, but these next 2 years will likely go even faster. Be willing to push outside of your comfort zone. Growth occurs most when we are pushed beyond our limits of comfort and beyond our limits of experience. Take the hard shifts. Raise your hand when there's an acute add-on at the end of the hour. Be willing to put yourself out there, because each case experience you get, each treatment plan that you get to discuss with an attending is more experience, more knowledge to bring to your future medical practices. Another part of being human is taking time for self-care. This is a time to practice what you preach. Eat right, meal prep, Make sure you're drinking plenty of water and taking time to get proper sleep. And most of all, have fun. This is such an exciting time, and you're building relationships with your future colleagues. So make those connections and bonds. Head north for a few days to get out of town, study by the pool, and make sure when you do get together to study, to take breaks to laugh, stretch, and eat. This program is a marathon, not a sprint. Well, it may be more accurate to describe it as a sprint marathon. So make sure that you've got a little fuel in your tanks when you graduate. You are surrounded by faculty, staff, and peers who will work to support you to become the best naturopathic physician possible. This is a lifelong journey of education, one patient and life experience at a time. Allow your time in clinic to cultivate your commitment to rigorous research, case analysis, and collaborative learning. Make the most of your time. I have watched many students go through their clinical education and leave not just with more medical knowledge, but with more personal strength, certainty, and compassion. Being a doctor isn't just about what you know, but how you carry yourself and how you hold space for other people. After reflecting on my experiences in clinic and in private practice the past few years, I have come to realize that the therapeutic relationship can promote healing just as much, and sometimes even more, than the right treatment plan. When a person, regardless of their role, feels heard, feels empowered, and is shown compassion along their journey, amazing things can happen. As Hippocrates said, wherever the art of medicine is loved, there is also a love of humanity. This white coat symbolizes your commitment to patient care and your commitment to your education. Strive to commit yourselves to excellence, not only in the scientific and technical areas of medicine, but also in its human and humanitarian aspects. Cultivate compassion for yourselves and your patients. Reach out to support one another, and make sure to remind each other to take care of yourselves. Because you are doctors in training, yes, but you are humans first. On behalf of the faculty and staff at SCNM, I congratulate you on this great honor and look forward to watching the personal and professional growth that takes place over these next 2 years. Thank you.
Thank you, Dr. Grice. And now, for the moment you've all been patiently waiting for, the presentation of the white coats. While the students make their way backstage for the presentation, please allow me to introduce the doctors who will be participating in this section of our program. Dressing the students in their coats will be Basic Medical Sciences Professor Dr. Arben Laskew. Dr. Laskew has been at SCNM for almost 20 years, teaching pathology, laboratory diagnosis, immunology, and hematology, ensuring that students can understand disease and make effective treatment decisions in the clinic. The students asked Dr. Laskew to dress them because they feel that he has always been vested in their success as doctors. Leading the students in the white coat oath will be the chair for the Department of Homeopathy and Pharmacology, Dr. Stephen Messer. Dr. Messer has been teaching homeopathic medicine since 1984 and is among the very first NDs in the United States to obtain board certification by the Homeopathic Academy of Naturopathic Physicians. He is one of only a handful of founding faculty members here at SCNM and was voted the top homeopathic physician in Phoenix in 2013. Dr. Stephen Messer was asked to lead the white coat oath because as a teacher, mentor, trailblazer, and leader, Dr. Messer personifies the dedication to the advancement of naturopathic medicine that these students wish to emulate. And finally, our president, Dr. Paul Mittman, will be congratulating the students on this milestone and welcoming them to the clinical training portion of their studies. So, ladies and gentlemen, without any further delay, please welcome today's white coat recipients. Ryan Abdelnour. Kayla Annan. Danielle Anderson. Harriet Bailly. Casey Martell. Carissa Bausch. Sarah Bedford. Victoria Chukobu. Christina Covey. Being coded by her father, Dr. Lawrence Duffy, Caitlin Duffy. Julia Find. Alec Fisco. Kaylin Galloway. Garza. Shay Herndon. Maria Herzog. Being coded by her mother and father, Dr. Niru Keshik and Sumesh Keshik, Neha Keshik. Danielle Langston. Lauren Latanza. Nicole Lauren. Anthony Lytle. Jeff Maximi. Rachel Hickey. Elizabeth Malley. Jennifer Metcalf. Carly Munson. Megan Moore. Morales. Zachary Moran. Hassan Mustafa. Swikar Patel. Ashley Wiley. Salume Munaji. Lorena Ryder. Amanda Wiskowski. David Saba. Molly Santaswaso. Natalie Sheeler. Hannah Schroeder. Elizabeth Shaw. Corey Shepard. Being coded by his mother, an alumni of SCNM, Dr. Sharon Stills, Benjamin Stills. Kyra Warren.
That's my girl. I knew you could do it. Told you could do it. Jennifer Wendland. Michaela Werner. Aubrey Ziegler. Thank you, Dr. Mittman. Thank you, Dr. Laskew. White coat recipients, I ask you to now please rise as I bring to the podium Dr. Messer to administer the white coat oath.
Okay. Here we go. You guys ready? All right. Please repeat after me. I, and state your name. As a student of the Southwest College of Naturopathic Medicine, will enter the clinical portion of my educational training with an open mind and an eager spirit. I will incorporate the information I have learned in the classroom with the knowledge that is now being passed on to me by my clinical supervisors. As a student clinician, I will parallel my therapeutic approach to the basic principles of naturopathic medicine. First, do no harm. The healing power of nature. Identify and treat the cause. Treat the whole person. Physician as teacher. And prevention is the best cure. I will treat each patient individually, and I will look for the cause and treat the whole person. Each time I wear my white coat, I will do so with honor for those that trust me, with an open mind for those that are educating me, and with respect and responsibility for those who have paved the way before me in this profession. Congratulations, class of spring 2020. Welcome.
Thank you for sharing this important milestone with us today. Please remain seated while once again our musicians Erica and Ralph Santasuaso, the sister and father of white coat recipient Molly Santasuaso,
All right,
Like then you might
Molly.
eventually perform today's recessional music.
All I can say is that my life is pretty plain. I like watching the puddles gathering, and all I can do is just pour some tea for two and speak my point of view, but it's not safe. It's not safe. I just want someone to say to me, no, I'll always be there when you wake. Yeah, you know I like to keep my cheeks dry today. So stay with me and I'll have it made. I'll have it made.
I'll have it made.
Ooh, I'll have it made.
I'll have it made.
I know I really wanna have it made. No, I'm really gonna have it made.
This concludes our ceremony. Have a wonderful day.